Welcome back to the show, everyone. I'm Chloe, and today we're diving into a truly profound shift in healthcare, one that has touched countless lives over the past 4 decades.
It's a pleasure to be here, Chloe. Thank you for having me to discuss such an important topic.
Alex, you've witnessed firsthand the incredible transformation within hospice care. We're tracing the dramatic evolution of hospice physicians from their early days as dedicated volunteers to becoming the vital, recognized medical subspecialty they are today. What an incredible journey, wouldn't you say?
Absolutely, Chloe. It's been a remarkable 4 decades, seeing the field mature and gain the recognition it so deeply deserves. The dedication has always been there, but the structure, specialized knowledge, and the interdisciplinary approach have truly blossomed.
It truly has, Alex. You mentioned the field maturing and gaining recognition. Could you elaborate on what that looked like in practice? How did the role of a hospice physician evolve from those initial volunteer positions into the essential specialized roles we see today?
Well, Chloe, in the early days, it was often driven by a deep sense of compassion, with physicians volunteering their time. But as the need grew and the understanding of end-of-life care deepened, the demand for structured, expert medical input became undeniable. This culminated in a significant milestone in 2006 when hospice and palliative medicine was officially recognized as a medical subspecialty. That really solidified its place within the healthcare system.
That's a huge step, recognizing it as a distinct subspecialty. What does that recognition mean for the day-to-day responsibilities of a hospice medical director or a hospice physician now? How do their roles differ from those early volunteer days?
It's a world of difference. Today, hospice medical directors, or HMDs, are responsible for the entire medical component of hospice care. They supervise other hospice physicians, ensure proper eligibility determinations, and are deeply involved in quality assurance and performance improvement programs. Hospice physicians in general need incredibly strong prognostication skills and a deep understanding of eligibility guidelines to truly advocate for their patients. It's a highly specialized skill set.
So it's not just about providing comfort, but also about navigating complex medical and regulatory landscapes. I imagine the complexity of medical care itself within hospice has also increased over time.
Absolutely. We've moved far beyond basic comfort care. Now there's a significant focus on advanced palliative interventions, things like patient-controlled analgesia or non-invasive ventilation. Some hospices even support advanced treatments like radiation therapy, transfusions, or dialysis, even if they aren't strictly required under the Medicare hospice benefit. Physicians are constantly balancing clinical appropriateness with cost-effectiveness, ensuring patients receive necessary pharmaceuticals while also responding to fiscal and regulatory inquiries. It's a delicate balance.
That sounds incredibly demanding. Beyond direct patient care, do hospice physicians also play a role in educating the broader medical community or engaging with the public?
They absolutely do. HMDs and HPs are increasingly engaging with the community. This means educating colleagues and other healthcare providers about hospice care and collaborating with medical leaders and partner organizations. They're also vital in medical and nursing education, offering clinical rotations and participating in conferences. It's about spreading awareness and expertise, ensuring more people understand the benefits and complexities of hospice.
It's clear that the role has expanded dramatically, encompassing clinical, administrative, and educational responsibilities. With such a demanding and emotionally charged field, I imagine ethical considerations and physician well-being are also paramount.
They are, Chloe. Ethical principles are crucial for navigating the clinical and even business-related dilemmas that can arise. And honestly, the demanding nature of hospice work can lead to burnout and compassion fatigue. Self-awareness and strong support systems are absolutely essential for maintaining physician well-being in this field. It's a journey that requires not just medical expertise, but also immense personal resilience.
Given that immense personal resilience, Alex, What about the ethical challenges that arise? You mentioned they can be both clinical and even business related.
Yes, Chloe, it's a significant aspect. Hospice physicians often face complex ethical dilemmas, not just in direct patient care, but also in the operational side of things. We need a systematic approach, grounded in ethical principles, to navigate decisions around treatment limitations, resource allocation, or even business practices that might impact patient care.
That makes sense. And with patients and families becoming more involved in the referral process, I imagine that adds another layer of complexity to these ethical discussions and overall care planning.
Absolutely. Referrals are increasingly coming directly from patients, their families, or caregivers, which is a wonderful shift towards person-centered care. This means we're really focusing on aligning care with their specific goals, often continuing routine medications and even incorporating advanced palliative treatments that might not have been common in earlier hospice models.
So, with all these evolving clinical and ethical complexities, there must be a significant administrative burden as well. How do hospice physicians, especially medical directors, manage the regulatory and documentation requirements?
That's a huge part of the role, Chloe. Hospice medical directors have extensive regulatory and administrative duties. They're responsible for meticulous documentation, ensuring appropriate billing for patient visits, and meeting strict regulatory requirements for things like face-to-face encounters and certifications of terminal illness.
It sounds like a lot of oversight is required. Does this also mean that strong leadership skills are now more critical than ever for HMDs?
Definitely, leadership is paramount. HMDs need to work collaboratively with both clinical and non-clinical leaders within the organization. Their leadership ensures consistent, high-quality medical care across the board, and that the entire team is aligned with the hospice's mission and regulatory compliance.
It's truly remarkable how much the role has expanded. From those early volunteer days, it's now a highly specialized, multifaceted position. We've seen the field grow to nearly 6,000 Medicare-certified hospices.
Indeed. In 2022 alone, there were 5,899 Medicare-certified hospices in the U.S., serving 1.72 million Medicare beneficiaries. That growth underscores the critical need for these specialized physicians.
So, to recap, modern hospice physicians are not only experts in prognostication and symptom management, but also ethical navigators, patient advocates, educators, and administrative leaders.
Precisely. It's a holistic role that demands a unique blend of medical acumen, compassion, and strong leadership to ensure the best possible care for patients and their families at a crucial time.
Alex, we've talked about the incredible growth and specialization of hospice physicians. Now, I want to delve into something truly foundational to modern hospice care, the interdisciplinary team, or IDT model. How central is this collaborative approach to delivering comprehensive care today?
Chloe, the interdisciplinary team model isn't just central, it's the very backbone of hospice care. It's about bringing together a diverse group of healthcare providers, physicians, nurses, social workers, chaplains, and more, to ensure every aspect of a patient's well-being is addressed. This collaborative approach ensures that care is truly comprehensive, looking beyond just medical symptoms to encompass emotional, spiritual, and social needs.
That makes perfect sense. So, within this IDT, what specific roles do hospice medical directors and hospice physicians play? How do they ensure that the medical care provided aligns with the patient's and their family's goals?
Their role is absolutely crucial. Hospice medical directors and hospice physicians are key members of the IDT. They're responsible for overseeing the medical plan of care, ensuring it's not only clinically appropriate, but also deeply aligned with the patient's wishes and their family's values. They lead discussions, provide medical expertise, and help translate complex medical information into understandable terms, empowering patients and families to make informed decisions about their care journey.
It sounds like they're really the medical compass for the team, guiding the direction based on individual needs. Does this IDT approach also enable more advanced palliative interventions, even in settings like a patient's home?
Precisely. The IDT model is what makes advanced palliative interventions possible and effective, even in non-traditional settings like a patient's home. Because you have this coordinated team, you can manage complex needs. We're talking about things like patient-controlled analgesia for pain management or non-invasive ventilation for respiratory distress. The team works together to ensure these interventions are safely and effectively delivered, maintaining comfort and quality of life.
That's a significant advancement, bringing hospital-level comfort to a home environment. Shifting gears slightly, how does this IDT model support the broader concept of person-centered care, especially when it comes to managing high symptom burdens or even deprescribing medications?
Person-centered care is intrinsically linked to the IDT. It means tailoring every aspect of care to the individual. When managing high symptom burdens, the IDT collaborates to find nuanced approaches, often involving a combination of pharmacological and non-pharmacological interventions. And with deprescribing, it's a careful, team-based decision. The physician, in consultation with the patient and family, and supported by the IDT, evaluates which medications are truly beneficial and which might be causing unnecessary side effects, always prioritizing comfort and quality of life.
So it's about optimizing, not just adding. We've also seen an increase in direct requests for hospice services from patients and families themselves, rather than just traditional medical referrals. How has this shift impacted the IDT model and the delivery of person-centered care?
It's been a very positive development. When patients and families directly request hospice, it often means they've already done some research and have a clearer understanding of their goals. This empowers the IDT to immediately focus on those specific needs and preferences. It reinforces the person-centered approach because the conversation starts with their desires rather than a medical diagnosis alone. The IDT then builds the care plan around those expressed wishes, making the patient truly the captain of their care.
It sounds like the IDT model, combined with this growing patient advocacy, creates a truly dynamic and responsive system. It's not just about providing care, but about co-creating it with the patient and their family.
Exactly, Chloe. It's a testament to how far hospice care has come. The IDT ensures that every patient receives holistic, individualized care that respects their autonomy and dignity right up to the very end.
Alex, as we wrap up, it's truly remarkable to reflect on this journey. We've seen hospice physicians evolve from dedicated volunteers to a recognized medical subspecialty, deeply integrated into the interdisciplinary team model.
It's been an incredible transformation, Chloe. The professionalization of the role, the emphasis on advanced palliative care, and the commitment to person-centered care through the IDT have fundamentally reshaped end-of-life support.
And that focus on the individual, ensuring their dignity and choices are paramount, really underscores the heart of hospice care. It's a testament to the resilience and compassion of these physicians.
Absolutely. It's a field that continues to grow and adapt, always striving to provide the best possible comfort and quality of life. Thank you for this insightful discussion, Chloe.
Thank you, Alex, for sharing your expertise. And to our listeners, we hope this conversation has offered a deeper appreciation for the profound impact of hospice care over the past 40 years. Join us next time.